So I am going to do the communicable and infectious disease. This is my own like notes. It's just everything is written together to have an understanding of everything. So there are only 5 pages for the communicable and infectious disease. If you find it more accurate and more knowledge from somewhere else, you can always study it from there. This is just my own notes, so I'm just sharing this one, and I only did this one. So if you find it even more, we will do it from Toronto notes as well. If you find like other chapters or whatever, you can always those from there. Okay. So we're going to start with communicable infectious disease. So basically, this is public health. Epidemiology pattern, like you need to know which one is sporadic, which one is endemic, which one is epidemic. So the definition, obviously, that's very important. So how do you make the difference? So sporadic is basically intermittent or up with occurrence, irregular interval, comes and goes, comes and goes. Random location, it's not only in one location, it could be sometimes in Manitoba, then maybe in America, some location, maybe in somewhere else location. Then scattered cases, like 5 people here, 5 people in somewhere else, 5 people in somewhere else. Like how the rabies is. Rabies is basically sporadic. Then comes the endemic. Endemic is continuous occurrence. It is going on for like, 1 year, 2 year, kind of that steady frequency over a period of time. So started from 2020 and then it's going on still 2021, 2022, 2023. Inherit in that locality. So basically it's in the indigenous population. So it's going on and on and on. So it's like how the malaria is in Pakistan. It's on and on and on. Even you try to kill it, but once it got, the weather or season, it comes back again. So it's like this. Like endemic, like means into that thing and it's there. It will come back again. Then epidemic is like an outbreak, like how the COVID-19 happened. Greater than usual, it's too much, shorter period of time. So usually many areas of the world got affected with this one. Then comes the pandemic, which is basically same disease, different countries. And then concurrent occurrence. So it's going on like if it's happening in America, at the same time it's happening in Canada, at the same time it's happening in other countries, so at the same time it's happening in the different countries. So I hope that makes sense. And this is the main key points that you are looking in the definition to divide that this is endemic, this is epidemic, this is sporadic, or this is a pandemic. So this is 4 type of the epidemiology pattern, and you need to know the difference. It's very, 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 very important, that difference. And they can ask the MCQs directly, straightforward definitions, and ask you to divide whatever it is. Okay. Then the difference of the nosocomial and the community acquired infection. So nosocomial infection is basically coming from the hospital, and then community acquired is basically coming from the like outside the hospital. So infection that is acquired after 48 to 72 hours of the hospital stay, and then infection that is acquired within 48 to 72 hours of the hospital stay. So this one is still you are in the hospital, community acquired, and the nosocomial stay, you left the hospital and then it happened to you, like after 48 to 2 hours, like 2 to 3 days after that. Stages of illness is basically, you need to know, it's very important. Okay, please, each and every single line is a very important. I put together, so it's nothing to be skipped. Then comes the incubation period, when the pathogen enters, no signs and symptoms yet, insufficient number of pathogens. Then the prodromal period, then appearance of the initial sign and symptoms. The pathogen continues to multiply, so it's now the period it is growing. Then the period of illness or acute stage, all since signs and symptoms appear. Signs and symptoms are most obvious and where pathognomic signs appears, then characteristic signs of the specific disease. Then comes the period of illness, now decline, where they start dying, or they start disease decreasing. Then signs and symptoms of the disease or illness begin to decline. In this period, the client is prone to secondary infection, so it can, once one thing is dying, so other thing can develop. So because their immunity is suppressed. So please keep it in your head that if they are giving you an example where they say that one, like he was having diarrhea, but his diarrhea is getting better, but he's now having fever, which period it is. So in that case, the diarrhea is dying. This is a period of decline. And now fever is starting. It means there is new thing starting. Okay. So period of illness is when there is symptoms very going on, like there is diarrhea and then she is having 3 to 4 5 episodes of diarrhea keep happening again and again, again and again. So this is a period of illness, like acute stage. Then comes the prodromal stage. There is the initial symptoms are there, like having pain in the abdomen, going on and off, those ones. Then the convalescent versus the deferescent. Convalescent is basically complete recovery, or deferescent is basically where there is complications or either the death. Okay, so they are the words that you are looking for, what you need to remember from here. Then chains of infection. So it comes either from bacteria, virus, fungus, or the protozoa. How to break the chain? So rapid organism and identification, like making that rapid diagnosis that, oh, is it coming from the water? Is it coming the rotavirus? Where is it coming from? So it is identifying the cause. Then prompt treatment. If it's a viral one, then maybe giving them Tamiflu, like antiviral, or giving them whatever it is. Then decontamination, maybe like, if it's the water that is causing the problem, like where it is coming from, decreasing the source from there. Then comes the virulence factor. So there is the different stages here. So virulence is the ability to cause a disease, overall strength to cause a disease. So depending on how, like some viruses are there in your body, but they are not efficient to cause any kind of symptoms or any kind of disease. So those ones are not the virulence ones. Some, which one, like rotavirus, they, if they enter into the body, they causes diarrhea. So that's what they're talking about. Then comes the infectivity capacity to of agent to enter and multiply. Now it's like thing, like a flu thing. If it's in enter into the body, now it causes a flu symptom and it is there. Okay, so it says that it is entered. Now they are susceptible to divide into further and then make it more complicated. Then invasiveness, where they penetrate in an intact skin, like touching, and those things can be causing by, like, how you touch and then you touch through that one and then enter through your mouth or whatever it is. Then the pathogenicity capacity, if the agent to cause a clinical disease in the infected host. Then the toxigenicity, if there is a toxin that is produced and released. Then antigenicity, ability to combine specifically with the final products of the mentioned responses, for example, antibiotics and the cell surfaces. So this is basically antigenicity. Then comes so we talk about the infectious agent. Now we are talking about the reservoirs, the one that is already been stored there, any site where the pathogen can multiply or merely survive until it is transferred to a host. So it is basically either a human reservoirs, animal reservoirs, environmental, like plant, soil, there is there, how to break the chain. So you have to look for the environmental sanitation, asking for good health and hygiene. So this can be asked, okay? Decontamination, sterilization, dressing change, PPE, you know how it was, line and disposal, proper feces and urine disposal, so it does not contaminate it and causes the hepatitis B, C, all of those one. Portal of exit, path by which the organism exit the reservoirs, like how they transfer from one body to another body, like how from vomit, saliva, they can transfer from there to other part. Cuts in the skin, the blood can cause HIV transmission. Then during diapering and toileting, like the stool one, so it can transmit hepatitis B. How to break the chain is basically control the sen excretion. So you can see the control for the chain to for the reservoir is different. The control for the portal of exit is different. Okay, so that reservoir is where you environmentally you have to, keep the soil or whatever you contact with, that when you have to keep it clean. Now here you got in contact with someone's body's fluid, someone's body's feces or whatever. So then you have to do is basically control of secretions, hand hygiene, waste disposal, avoid taking and coughing and sneezing over the open wounds or sterile fields, and cover open and sorry mouth and nose when coughing and sneezing. Then comes the mode of transmission, means by which the agent passes through from the portal of exit to the reservoirs, of the reservoir to the host. So direct contact, and then comes the indirect contact. How? Direct contact is skin to skin contact or sexual contact. That is like, there is nothing between them and it just got directly transferred. Now comes the indirect contact. The indirect contact is transferred through five things. Indirect transmit can the infectious agent. So five things are which one? Feces, fluids, food, finger, flies, vomits. no development of the stage. So in that cases, then comes the airborne. So we are talking about the direct contact and the indirect contact. In the direct contact, it could be airborne. Airborne is basically, like TB, suspended longer, travels more than 3 feet. So it's like a, giving you example, TB. Then the droplet infection where you pass the fluid, like how flu can transmit it, like you sneeze on someone and then they got it. Then the aerosol where they're talking about the tuberculosis, measles, chickenpox, droplet of saliva, what can be transmitted through that one. And it is very important question. They can be asked like how does the transmission of the measles, mumps, rubella, or what kind of organism can be transmitted through saliva. So measles, mumps, infectious mononucleosis can be transmitted through. In the indirect contact, the transmission is where from the vector, like mainly which one, the mosquito takes those ones. The animal insect that can transmit the disease development of the agent, like mosquito, fleas, and then ticks. How to break the chain? Obviously, how to break the chain can be asked in this way. How will you manage this condition? How will you deal with this situation? What do you do next? So these are the questions to be asked for this one. Hand hygiene, isolation, precautions, disinfection, sterilization, use of PPE, and then aseptic techniques. Then comes the fifth one, portal of entry, how it can enter. So mouth, cuts, or eyes, how to break, obviously contamination and aseptic measures, hand hygiene, aseptic technique. Then on the side, wound care, puncture resistant containers. Then comes the susceptible host, how to break the chain if there is someone that is like infected and now he can transfer. In that cases, you have to recognize which one has, like, the person who has TB. So you have to recognize which person has TB, that then it's prompt treatment, maintain the skin integrity, and then balanced diet, and then immunization. Risk factors of susceptible host is which one? Children's, elderly, weakened immune, unimmunized person. Infection control. How do you control the infection? It's very important. Four things. What are those ones? Aseptic technique, standard precaution, transmission-based precautions, and then isolated techniques. Then comes the CDC and prevention isolation guidelines. Tier 1, a standard precaution. Which one is the standard precaution? It is a very important question. Very, very important. What is a standard precaution and what is the, like, the further ones? So the standard precaution is designated is which one? So this is a primary prevention we are talking about. Hand hygiene, PPE, respiratory hygiene, like, coughing, like covering your mouth while coughing and all that. Then puncture resistant containers, those ones, like, the needle boxes where you put the needles and all that. Then comes the in PPE, upon wearing in sequence, like you have to start with gown, then mask, then eye wear, and then the gloves. So you can wear the gloves in the very last. Upon removing, the sequence will be gloves, eyewear, gown, and then mask. Tier 2 is basically transmission-based precautions. What are those ones? Airborne precautions, isolate, negative air pressure. So how do you kill that all the airborne whatever problems? So you have to first isolate that person who, first of all, for example, if we're talking about TB, so you have to isolate that person after identifying. Then negative air pressure room, then the N95 mask. Then the droplet precautions, how do you do that? Obviously, isolate, mask, 3 feet distance, then gloves. Contact precautions, how do you do that? Isolate, wear PPE. Protective prevention environment is which one? Then the people undergone gene therapy, organ transplant, and those ones administer drugs that cause the immunosuppression, like, azathioprine, mesalamine, for the one that they are taking for Crohn's disease, those ones. Hand hygiene, it's very important. PP, again, respiratory hygiene, and then the puncture resistant containers. Then we are talking about the categories recommend in isolation. What are those ones? First of all, there are people who you have to strictly isolate. Like they in any chance they cannot be get in contact with other person. Which one are those ones? COVID-19, measles, and chickenpox. If you could see the news these days, chickenpox is going very common in the Alberta, Quebec side. So that's why this says that strict isolation is very important and immunization is recommended. Then the contact isolation, in the contact isolation where they get transferred through touch. Which one is that one? Herpes simplex, impetigo, parasitic mites, then chickenpox. Okay, shingles, like those ones. Then comes the respiratory isolation. Again, we are talking about COVID and measles. TB isolation itself is very important. That enteric isolation, which one is enteric one? Like, the fecal oral one. Cholera, hepatitis A, diarrheal diseases, those ones. Drainage secretion isolated, that Jackson Pratt drainage of the patients having brain abscess, then the burn patient. So in that cases, you have to do a very careful drainage. Then the body and the blood and body fluid isolation, which one are the most important one? Hepatitis B, hepatitis C, AIDS, malaria, syphilis, this could be transmitted. Mainly is the HIV, hepatitis B and the syphilis. Malaria is very less likely here. Then what is the reverse isolation, protective or the neutropenic isolation? The people who have leukemia, neutropenia, those ones. Then the medical asepsis, then the surgical asepsis. What are the difference between the medical and the surgical? When we are talking about the medical, reduces number of the pathogens. Surgical is reducing or eliminating all the pathogens by, cleaning them through some aseptic measures. So medical asepsis is basically clean technique, like using pyodine, pavodine, putting all those ones and cleaning it up. But when we are talking about the surgical, it means the sterilization of all the instruments and all of that. Uses of administration of the medication, like, where you put antibiotics, prophylaxis antibiotic, or cleaning the wound, or whatever it is. That one, enemas, tube feeding. So these are all the medical asepsis, should be done in the medical asepsis. So for these process, we do the medical asepsis. That, like, using the sterile things and all that. Daily hygiene, proper cleaning of the supplies and instruments, then proper disposal of the needles and contaminated materials and infectious waste. But when we are talking about the surgical things, then, going through that process and cleaning them, which one? Dressing changes, catheterization, surgical procedures, operating room, the delivery room, labor room, and then special diagnostic area. So you have to remember which one is which asepsis. Now we are talking about the areas. I mean, this is important. There are one or two questions from here in the MCC practice test. So that's why the black one is the dry non-infectious waste. The green one is wet non-infectious waste. Yellow is infectious pathological waste. Then comes the yellow with black. That is the chemical waste or heavy metal. Then the orange one is basically radioactive waste. And then the red one is the short one. Consideration for the cohorting. How do you do the cohorting? Placement and care of the individuals who are infected and colonized with the same microorganism. Like, if someone got infected with the hepatitis B over and over, then in that case is client diagnosis, presence or absence of infection, infections clients are considerably dirty. So, whoever has infections, those are considerably dirty. And then post operative clients are considered clean. So after that one, because we did antibiotics and all that. So in this one. Then the isolated technique. So isolated techniques are either room pressure. So in that case is the source and protection. So room pressure, the source is negative, but the protection is high. For protected, source is like coming from others, and then the patient is the one that is protected. So you have to do that. And then the person movement of the air, it's in or out. So in is basically for the source, and protective is basically the out, where you remove the air and make them airborne, remove from airborne disease and all that. Then we are talking about the transmission based precautions. How do you talk about the airborne transmission? How do they get transmitted? So patient can transmit chickenpox, measles, and TB. Placement, if you place them in the negative pressure private room, it can kill the airborne diseases. Then if there is a PPE, N95 can help with that one. Then the transport, the limited of the essential purpose, place a surgical mask. So if you wear those ones, it can kill the at least airborne diseases. Then when we are talking about the droplet, how do you control the droplet infection through patient? What can you control? Diphtheria, meningitis, pertussis. Through placement in the private room, you have to keep them like a isolated room for each of them. Then PPE, like the instrument that can be used is basically mask, like covering their mouths, because the droplet can be only transferred through the mouth. Then the transport is limited to the essential purpose. So only where it is needed, then they can move around and place a surgical mask. Okay. Then comes the contact in the patient who has decubitus ulcer, they can transmit the infection. So those ones, and discharges, like wherever the yellow discharge or whatever someone get in contact with, that they can transfer that one. Then the placement, obviously you have to, if you put them in the private room, it can be helpful. Then PPE is basically gloves and gowns. Then the transport is limited to the essential purpose. I hope this makes understanding of what questions can be asked. So let me give you an example. So a question can come like a person, he is having a decubitus ulcer, and what is the main source of transmission of this disease? So the things is uh, gloves, gown, whatever, private room or whatever it is, and then the answer is, one option is patient. So if you can see which can transfer, the main answer is basically they're talking about the patient can transfer this decubitus ulcer or discharge to different places. Okay. All the gloves and gowns and everything can transfer, but who is taking it? Obviously, the patient is the one taking it now. Then comes the vector-borne and zoonotic diseases. Oh my goodness, this one is important. Then comes the dengue fever, acute febrile disease transmitted by the mosquito. And then the causative agent is Aedes, and it is a day-biting mosquito. It breeds in a stagnant water. DF can be infected 4 times, and 3 infection is basically dengue fever. Which one? The other ones, the viruses is basically dengue virus 1, dengue virus 2, 3, 4. Chikungunya can be transferred, and then the airborne viruses. So then comes the pregnant woman can pass DF to their children. So dengue fever, they're talking about DF. Crosses the placental barrier. Dengue hemorrhagic fever, a severe form of the dengue fever that causes the severe bleeding, and dengue shock syndrome. Then a little bit more about the dengue one, 1 to 3 days. Then the febrile one, in that cases, they will be mainly febrile. There is a pain, headache, eye pain, muscle joint, and the bone pain. Then maculopapular rash, minor hemorrhagic petechiae is there, ecchymosis, purpura, epistaxis, gums bleeding, hematuria. So mainly bleeding, bleeding, bleeding. Dehydration, high fever may cause the neurological problems and febrile seizures. And in 4 to 7, there is circulatory problem because the bleeding is the problem. Then now it will affect the circulation. Critical phase of the dengue begins at the deference and typically last 24 to 48 hours. Most patients clinically improve during the phase, so usually they start getting better. Can develop severe dengue to those having the substantial plasma leakage, leading towards a marked increase in vascular permeability, and then shock from the plasma leakage, severe hemorrhage, and then all those. Then comes the recovery phase where you did the plasma leakage, patient enters the convalescent phase, begins to reabsorb IV fluids, now start getting better, and there is maybe effusion started, hemodynamically stable, starts getting stabilized, like, may manifest bradycardia, diuretic enuresis. Then they might have stabilizes or may fall because of the dilutional effect, because now the water is coming inside. WBC count start rise, and then platelet is basically um, count recovery, convalescent phase, rash, dissequamates, and then bipyritic hypovolemia, IV fluids had been excessive. Then comes the dengue fever grading. So if you could remember this one, this is more than good enough. Grade 1, grade 2, grade 3, grade 4. Grade 1 is non-symptomatic. Grade 2 is where there is symptoms along with little bit of bleeding. Then grade 3 circulatory shock, and 4 is basically with a shock. Who definition of DF is fever, hemorrhagic shock, and then platelets. Then diagnosis, how do you do the diagnosis? Tourniquet test, take the patient blood pressure and record it, inflate the cuff to a point the midway between that one, and then see, reduce and wait 2 minutes, then count petechiae below the antecubital fossa, and then the tourniquet test 10 or 20 punctures per 1 square inch. How do you manage? Obviously, it's a fever, so then you have to do is what? Hydration, analgesics, antipyretics, blood transfusion, environmental control, oxygen, Trendelenburg position, rehydration, and then sedatives. Prevention is how to destroy protective measures, PPE, mosquito repellents, all of those ones. Early consultation, no to discrimination fogging. Then filariasis, the filariasis is basically parasitic diseases may causes are extremely debilitating and stigmatizing diseases, then causative agents and vicious Bancrofty, lymph vessels, and then Crohn's one. So these are all for the public health. I think this is more than enough for you. Now let's do the some public health from little bit of from the this one from Toronto notes. So I'm opening Toronto notes. So from the start, there is some definitions that you have to do. What are the definitions? Population health, public health, epidemiology, and those all are the definitions. So you have to do epidemiology from here. Population health, what is the population health? Refers to the which one? Defined number of people, their health determinants, their trend in health. Yeah, I'll do it. Trend in the health and then the health inequality. So basically, we are talking about all the people and their health determinants. That is called the population health. Then comes the public health. Public health is an organized effort by society to promote, protect, improve. So here, so population health is when we are talking about, okay, this is me, this is you, this is this, and there, what is the health concerns they have. Now we are talking about public health. Public health is a separate whole different program. They take care about their screening, they take care about your immunization, they take care about your skills. So, protecting, improving, what else they can improve, how they can, imprint more people to get the vaccination. So they work on these department. That's how the public health works. Then the epidemiology. Epidemiology is the study of distribution of determined. So the definitions, it's very, very important, straightforward lines you have to remember. Determinants of the disease, health related states, and event in the population. Then comes the public health and the preventive medicine. In this one is basically called community medicine. The medical, especially that focusing on the population rather than the individual's health. So not only one person, they are working on the whole community, whole, like, if we're talking about community health, they are working in whole Ontario, not only on one person. Okay. So you can see on the sidebar what's written here. Infectious disease, a prominent issue in the low and middle class people. Which one are those ones? HIV, drug, TB, COVID-19, and in which crisis? So you can see this is what they are talking about. So it's in the common, in which one? Indigenous, black, or other communities of the color. They are common. Which one? HIV, drug resistant TB, or the COVID-19. Chronic diseases, which one? Heart diseases, high blood pressure, cancer, diabetes, all of those ones. And then they affect which one? The indigenous population. So it's very important which population get affected by which disease. Okay, so we already saw that the infectious disease affect which population, then chronic disease affect which population, then the social determinants of the health is basically where there is health equalities, checking for the significant improvement, how you can make it better, like, screening, immunization, and all that. Then when we are talking about the public health of the Canada, so public health in Canada is mainly where you do the, this is the one they're talking about here. So they're talking about the health protection. So you need to remember the names at least if you cannot remember inside. So mainly the health protection. Health protection is measure takes to address the potential health risk at the population level through regulation and advising the government, like, safe water, food supply. Like there are environmental engineers that work on that one, and there are other people that works on the other population. Then the health surveillance, where they're talking about the monitoring, predicting the health outcomes. Then the disease and the injury prevention, which one are those ones? The vaccination, droplet, quarantines, reduce the morbidity. So what are the 3, 4 factors? The first is the protection, then surveillance, and then the injury prevention. Then there comes the assessment, then promotion, and then the emergency preparedness. So they're talking about the assessment. Assessment is studying and engaging with the community to understand their needs and improve the policies. So you have to work together along with them. Then the health promotion, like telling them, go for the vaccination and all that, improved health through whatever the resources. Then emergency preparedness, like let's suppose if there is some outbreak of something happening, like man-made diseases, which one are those ones? Opioid one, marijuana ones. So in that cases, you have to work together to control them, like how recently Canadian government has introduced that no more Tylenol 3s should be given until unless it's required. If you prescribe, then in those cases, doctor will be answerable to the certain program of the provinces. So this is basically controlling the man-made pop disasters. Okay. Then again, you can read this side one, the Chief Public Health Officer of the Canada. So they can ask you what are the duties of the Chief Public Health Officer of the Canada. And now we are morely, you have MCQs and they do like to test these kind of things in MCQs. Okay. So responsible for the public health of the Canada. So obviously with the name you can tell as the federal government. So which government works with that one? Please keep it in your head because when we are going to do ethics, I will let you know because in the ethics they tell you which resources are controlled by which government. So you need to remember this one. So then we are talking about the federal government leads the public health. Okay, which government? Not the provincial, nothing else. Federal one controls it. This is a very important MCQs. The federal government leads to the provincial health professionals. Then provide advice to the Ministry of Health. Government of Canada collaborates with the other government jurisdiction. So here they work as an organization and countries together. So which one? The federal government work together. Then the communicates public health information to the public professional stakeholders. So, the food inspectors and all of them, this all work together. In an emergency, they do what do they do? Like if there is a natural disaster or anything, PHAC, including the medical professional scientists to coordinate the emergency response. So the officer is the one that works in the federal government and do work for the organization and control these man-made problems and imply the emergency in short. Okay. Then comes the legislation and the public health. So what do you need to remember here? The federal, what this is what I was talking about. So it's not in ethics, it's here. Which government controls or which part of the government controls which health resources? It's a very, 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 very important. Okay, it is most important question. They will like give you one or two MCQs from somewhere here. So Health Canada is provide health services to the Canadian military. So military is controlled by where? The federal. Okay. The First Nation providers non-insured health benefits to status, the First Nation policies, Inuit. So basically we are talking about indigenous. So indigenous is health is also controlled by federal, and then improves new drug and the medical resources and food guide, everything is controlled by the federal one. Public Health Agency of the Canada as an independent body is basically they work together for SARS, like strengthening the capacity health and then response, focusing on the preventing of the controlling chronic diseases like preventing injuries. You know how they improvise the belt for the people who are driving. So that's what they're talking about. Health emergencies and infectious disease broke out, like we're talking about telling the public health for the STIs, and then for the we're telling the MPI for the driving purposes. So those are the one they're talking about. Then the activities include the secretariat and then knowledge brokers and then all the airport health inspection. So in short, we are talking about everything that comes in the province. I hope that makes sense. So then the food inspectors also work under the federal government. So animal related diseases like rabies and all of that. So rabies, for your information, rabies is also you have to notify through the public health for the rabies. Okay, so rabies is also something you have to notify. Canadian Institute of the Health Research. So usually they all work together. So this comes under the federal government. I would suggest take a highlighter, highlight the only the points that I was talking about: indigenous, food inspectors, health inspectors, chronic disease, man-made issues. This is controlled by federal. Now comes the provincial. So in the province, into the province level. So federal is basically we are talking about one area or one section, like if we are talking about Toronto, Toronto's everything is different as compared to the other area of the Ontario. Now in provincial level is where the whole province works together. So this is basically where the chief medical officer of the health work together. So health inspectors are different. The health inspectors works in the federal level, then they come under the chief medical officer of the health. So they are controlled by them. So they what they do is public health hazards, specific diseases to be reported, which one, like any outbreak of any disease, certain disease happened in, like I just told you how the chicken pox or measles are going around in the Albert Alberta. So now what happened is if all Alberta is getting affected, so chief medical health officer, they will sit together, they will decide what to do, if they want to impose more immunization or they want to isolate the people. So they will decide what to do. Then we are talking about the mandatories are the public health issue, environmental issue, and then chronic diseases. They do work together if to see if for the how the insulin should be impacted for the for that whole province to improve the diabetes, stuff like that. Then comes the municipal. Municipal is basically the local public health units where they deliver the provincial policies. So they control mainly the infectious things. So mainly infectious. So it can come from school, it can come from preschool, daycares, public health services, like anywhere. So they are working together for those departments, hospitals, nursing homes. So from there, then the tobacco control legislation works, enforcement, then the assessment and management, collection, the dissemination of the local status, oral health, and they are talking about the municipal. Municipal is mainly, I hope you guys have an idea about the municipal community or community works. So we just talk about the chief public health officer. We are talking about now the medical health officer. So please, 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 please keep it in your head. What is the difference between the chief one and what's the difference between the medical officer one? And what is their authorities, what they can do and what a medical officer cannot do? It can be asked in MCQs. It's a very straightforward MCQs like, okay, this is controlled. Now can which person will handle it, or who is liable for it, or who will impose it. So they are asking about which person, like medical officer or the chief medical officer. Maybe have the medical health officer in other provinces appointed to each public health unit, the position held by the public health and the preventive medicine specialist physician. So they what they do is collect and analyze the epidemiological data. So you know how they do surveillance, going to the homes and asking for how many people live there. Okay. So how they send for pap tests to the people to their home. So these are the things. Then the provide the occupational and then environmental health surveillance. Then they're talking about the tobacco use prevention, checking for the prenatal. So those are one. So usually as a physician, as a family physician, I work on the prevention. So I am a medical officer of the health that works on the prevention. So me as a family physician is the person who will control for the prevention. Prevention, what comes in the prevention? STI screening, mammogram, fit test. So I have to make sure whichever patient is under my name or whichever patient is registered under my name, I have to make sure to check her uh, prevention. And if any prevention is missing and that person is not coming to me, I have to report to the public health so they can send the letter to them to follow up with us. Okay. Then the determinants of health. So we think we already discussed how the disease is. Disease is an abnormal medical disease changes. Then illness. Illness is basically, individual experience, a lack of physical or mental health. Then the illness behavior, when someone is feeling that they are weak, they are not feeling or avoiding something. Then the sickness. Sickness is basically, view or their society holds toward health condition, like this person is sick, that one. Impairment, now someone is unable to do something, either it's a psychological, physiological, or anatomical. Disability, now they cannot do it or restricted to do it. Handicap, so and disadvantage of an individual arising from the impairment. So this is a very important difference. Each and every definition is important. What comes under sickness, what comes under illness, although we have an idea, but usually we do mix up sickness, illness, impairment. What is the pet definition for that one? Then again, in the sidebar, what are the determinants? We are talking about the health. What are those ones? Employment, education. So each and anything that is affected, that comes in the health. So if someone is having problem in the employment due to the psychological issue, this is basically a determinant of a